Hello, my name is Lisa Archibek. As a member of Debate Group 3, I will present the reasons why the federal government should not regulate the cost of pharmaceuticals in the U.S. Americans pay more than any other country in the world for their prescription drugs. The skyrocketing cost of pharmaceuticals is a major concern in the U.S. More patients are not able to afford their medicine, and prices continue to rise. In recent years, the cost of prescription drugs have risen higher than ever before. One example is the cost of an EpiPen, a life-saving drug used by many Americans, which increased by 500% in 7 years. Other drugs, such as the Daraprim, increased nearly 5,500%. Outraged citizens and sick patients are helpless and are wondering why prescription drugs are so high. Lawmakers and consumers have shifted the blame to the pharmaceutical companies for exploiting them for the high prices. Many Americans are calling for the federal government to intervene and impose price regulations on the pharmaceutical companies. But is that really the best solution? Price regulations are used when the government mandates price minimums or maximums for certain goods. They are usually put in place to help more citizens afford the product. They're often used for food, housing, and gas. Price controls create problems in the long run because they lead to shortages, rationing, lower quality products, and illegal markets. Price regulations are not the solution for reducing prescription drug costs in the U.S. In fact, regulations are the problem. Price controls in the U.S. pharmaceutical industry would hurt Americans more than it helps. Meehan states, price controls are bad public policy that in the long run will increase the cost of prescription drugs to all citizens, including seniors and the poor. Costly rules and regulations imposed by the government are what forcing pharmaceutical companies to raise their costs in order to cover the billions spent on research, testing, and approval already. Instead of imposing unnecessary price controls, the government should focus their energy to reduce the regulations and policies that drive up costs of prescription drugs in the U.S. Hopper and Henderson state, more competition, more cost sharing, and the liberalization from some of the regulations will reduce U.S. prescription drug prices in the United States. Ultimately, price controls will lead to unintended negative consequences that do more harm than good. Price controls will lead to, specifically, a lack of competition and lack of innovation. Ultimately, if the federal government imposed price controls on pharmaceutical companies, the pharmaceutical companies would be forced to stop developing new, improved drugs and may exit the pharmaceutical market altogether. Lakdawala states, drug price controls would stifle the introduction of valuable new drugs because innovators will spend less pursuing new drugs if they expect to earn fewer rewards from discovering them. In essence, why would the pharmaceutical companies invest so much time and energy into research to not get a return on their investment? Lakdawala also estimates that the savings would be about 20% if the price controls were imposed. However, we would lose less in innovation than we would gain in savings. Additionally, if fewer competitors were in the market and profits were minimized, there's no incentive for the companies to spend money on research. Therefore, it reduces competition altogether. One way the government can intervene to help reduce costs in the U.S. is to improve the FDA's costly approval process. Ultimately, the cost of manufacturing prescription drugs is relatively inexpensive. Most of the costs are incurred in the development stage. Pharmaceutical companies are forced to go through costly, lengthy FDA approval processes in order to get their drug on the market. Getting a drug FDA approved could cost a company up to $2.6 billion in sunken costs, meaning they will never get the cost returned to them. Only 1 in several thousand drugs tested receive FDA approval. Therefore, the $2.6 billion includes all drugs that don't make it to the market. The cost of getting an FDA drug approved is also rising. Demasi et al. States that the cost of getting one drug approved increased 14-fold from $179 million in the 1970s to about $2.6 billion in 2016. Therefore, while the costs to make the drug go up, the costs to sell the drug are also going up. Although FDA approval is important, in many cases, it is often unnecessary. For example, the FDA required Roxro Pharma to run clinical trials for its Sprix nasal spray. However, the active ingredient in the nasal spray was used for over 2 decades. The trials took more than 2 years and cost millions of dollars, which in turn made the company increase their prices. The high prices could have been avoided if not for the FDA regulations that were unnecessary. Instead of increasing price regulations, the federal government should lean more toward fixing the broken regulations in place, such as the FDA approval process. Another option to reduce drug prices is to eliminate Medicaid's best practice rule and allow market segmentation. Market segmentation, also known as price discrimination, is when the price of a product is based on the consumer's income. For example, if you make more money, you would pay more for your prescription drugs. If you make less money, you would pay less for your prescription drugs. Medicaid requires pharmaceutical companies to offer Medicaid the best domestic price on every drug. Therefore, drug companies cannot offer lower prices to Americans who are not on Medicaid, or else they would lose significant profits from the population who are on Medicaid. If Medicaid eliminated the best practice drug rule, companies could offer lower prices to vulnerable Americans who don't qualify for Medicaid. Other countries allow for market segmentation, and it helps their poor citizens get medicine for free. Some argue that it's unfair to charge different prices for the same product. However, individuals who pay a higher price may also end up benefiting. Overall, prices would drop based on more volume of consumers. Another way to reduce prices in America is to increase over-the-counter drugs. Increasing over-the-counter drugs would help improve the lack of competition in the U.S. pharmaceutical market. Essentially, pharmaceutical companies can charge what they want because there are no other options that are more affordable. This hikes the prices up as well. However, over-the-counter drugs are 100% paid for out of pocket. Therefore, there is no insurance intervening or paying for part of the bill. That gives the incentives for drug companies to price over-the-counter drugs at a lower, more affordable cost because consumers are price sensitive. Estimates show over-the-counter drugs cost about 10% of their prescription counterparts. In conclusion, the current regulations are what causing drug prices to skyrocket in America. If the government were to impose price regulations, it would lead to fewer prescription drugs available, less investment in innovation and research, and will ultimately lead to more disease and death within America. Ultimately, price regulations won't save us money in the long run. It will only do more harm. Better options in lieu of price caps would be to improve the FDA's costly, unnecessary review process, allow drug companies to price based on income, and to approve more over-the-counter drugs into the market. In conclusion, the federal government should not regulate the cost of pharmaceuticals. Price regulations do more harm than good. Here are my references. Thank you.